Hi, my name's Katie. I've got two stomas. I've had one for almost 23 years and one for 18. I've got a colostomy and a urostomy. And as Brian has said, I had mine as a result of a back fracture way back in the early 90s. Um, as a result, I've had quite a few experiences with leaks of various sorts, a lot more from the urostomy than from my colostomy. So there isn't much I haven't come across, I think, in 23 years. Leaks are something which I know from working on the helpline for Colostomy UK and for the UA. Leaks are something which cause a lot of distress. And I can fully understand that because I've leaked in various places at various times. And the secret is always to be prepared, a bit like the Girl Guides. So if you just keep that in mind, just try and be prepared. The way I visualize it is that there's two sides to most problems, actually, but in this particular case, one is the practical side and the other is the emotional, which actually the emotional links well into the confidence side. Because often if we have leaks, and I know from recently, from my point of view, I had an overnight leak, which was very unusual. It does shake your confidence, and you think, am I going to do it again tonight? Is it going to happen again when I go out? So the emotional is quite a distressing situation sometimes, and sometimes it's quite hard to overcome. However, with every emotional side, there's always the practical. And often it's the practical side which we can address to sort the leaks, or at least try and get on top of them. And rather than seeing this as a problem, it's often worth seeing it as a challenge. So challenges are there to be overcome. So let's think about three aspects. One is, where do you have a leak from? The next one is, what causes the leak? And the third one is, well, we'll come to the third one in a minute because I think you will find that quite interesting. So, where do we leak from? Well, there are several areas, as you probably are really well aware, that you can leak from. One is the bag itself. Now, that's quite a tricky one for us to solve, apart from letting everybody know that you've got a faulty bag. And the manufacturers have to know that, because it's their problem, and rather it becomes our problem when we leak, but we can't actually do anything about it. It's not that common, I don't think. It depends. I think sometimes manufacturers have a run of bags which have a bit of a pinhole in them or something like that. So from the bag itself, another place you can leak from is from the bung at the bottom. Or the tap, whichever. Different manufacturers have different outlets. And the funny thing is that usually the bung is your fault, my fault, because I've done it. You put it on and you forget, to sort of secure the bottom, turn it off, bung it up, whatever you do. So that's kind of, an easy solution to that problem. And the third sort of area there is often where you join the night bag to the day bag or a leg bag, whatever you're using. Some people, I use a night bag, but some people use a leg bag overnight, or a night bag. But you can actually leak from the join occasionally, and there's a couple of things you can do about that. One is sometimes it may be the actual fault of the equipment. So you can always contact the manufacturer and make sure that you've got the correct join if you're using a different make of night bag to your day bag, your pouch. And the other thing is, I have known people sort of belt and braces with micropore round the actual connection. But that again is a purely practical problem with some solutions. And in the first instance, I'd probably, if you were really having problems, contact the manufacturer and find out if they can help. Another one, which actually I didn't think of until just now, is if you let your bag get too full. Now, it does happen. We can't avoid it. If you go to the theatre or something, um, or a cinema or somewhere where it's not easy because you've got to uproot everybody in the row to go to the loo, actually to make sure that your bag is empty before it all starts, because sure as guns it'll just fill up. And if it gets overfull, if it really becomes stiff and overfull, if you think about it, there's nowhere for the urine to go. It's not like being able to cross your legs. So it actually, what will happen is that it'll tend to come off your skin. The pressure from the urine will push the bag off. So just be careful to do that. That's another source of potential leaks. Right. So what can cause a leak? Well, one of them I've actually said manufacturing problems. Um, it's the one big tip I give you is I decant my bags into a drawer by my bed so that I can get up, I can pick up a bag. In fact, I've got two because I change every day, both of them. And I'm a bit naughty because sometimes I don't keep the lot number, but it is really well worth keeping the lot number if you actually decant your bags out of its box. Because if you have a faulty bag, um, the manufacturer, it's good if they know which lot, which batch it came from. Then they can go back in their records and see if they can find out. The next big reason for leaks is physical or medical. Now, the one thing I would suggest strongly, if you suspect either of those two, for example, often we gain weight or lose weight. Our weight sometimes changes for various reasons. And when that happens, and if it's happened to you, or if you have more surgery, the lie of the land around your stoma changes, and you can end up with dips and tucks and all sorts of odds and ends. And that sometimes can make it very difficult to get a good seal around the stoma. So that's one kind of physical change. Um, Another change, and a medical change, is if your skin gets very sore or very weepy, it's very hard for the flange to stick to that. Another thing is change in stoma size. Um, if any of you have had a recent bit of surgery, you'll know that the stoma always starts looking rather larger than it ends up, because as the healing takes place outside your body and inside your body, the stoma usually reduces in size. So you have to keep an eye on that, and not just you, I'll come to that in a minute. Another reason for leaks sometimes is infection. And I think the nurse talking in this, I'm sorry I can't be there because I've got another, I train dogs. So in fact, I'm dog training while you're watching this. But I believe that the nurse, the specialist nurse, is going to talk about UTIs. I had a situation not that long ago where I leaked in bed for the very first time for years. And I went to see my stoma nurse because it was so unusual. And she said I had an infection. And I wasn't aware systemically I had one, but it had altered the bit around the middle of your where your stoma comes through. I can't think of the word of it now, but it altered that and it had infiltrated and destroyed it. So I leaked out of there. So in fact, she died. I mean, it was sent off for culture, properly taken the sample, and it came back with an infection. So that was an easy solution to that problem for me. And another area which can raise the risk of a leak is a hernia, because hernias are obviously the same as if you've got weight loss and weight gain and that kind of thing. Hernias change the shape of your tummy. Some hernias are really big, some are quite small. I've had that, and so I know what it's like. I had it revised, so I don't have it now. For all of these reasons, medical and physical, I feel personally it's really important that you contact your stoma nurse and get it assessed. Please don't try and just second guess, what's causing it. If you're having a lot of leaks, there'll be a reason. So the stoma nurse is your first port of call, and they can assess the size of the stoma, whether your pouch is fitting correctly, whether you need a different sort of pouch because, for example, for hernias, or for retracted, that's stomas that go in rather than come out, or little ones in urostomies, get little stoma, and that's, you need help with that. And it's things like convex bags. Coloplast do a concave one. I'm not quite sure, but I think they use those for hernias. I'm not sure. But there are various types of bag, and there's also various manufacturers, and they all have their own little bits and pieces, and aloe vera surface, and some of them have like a little flower kind of arrangement where your bag sticks, doesn't sort of in a circle, it's got little indents so it really fits round your tummy in a different way. So, but the really important thing is to contact your stoma nurse, get assessed. Some people I've talked to haven't, I did talk to somebody who hadn't seen a stoma nurse for getting on for 40 years. Now, that is a long time. Our stoma nurses where I live try and see each patient once a year if possible, just to assess that everything is okay, even if the patient thinks it's okay. They like to see it and make sure. Not all stoma nurses are able to do that. So, but do contact them. If you're having constant leaks, please contact them, because again, it's a way to start to solve the practical issues. Stoma nurses can look at if we just go through them, they can look at, well, change and weight they can't, but what they can do is they can look at how to stop the urine coming under the flange. So you have seals, like little rings, they're produced by every manufacturer. They've got different depths to each ring. They've got paste. And again, they can try different bags. So certainly from that point of view, sore or weepy skin, they can look at why that's happening, and it may be that your skin's getting damaged with constant urine and so on. I had sore skin, and my stoma nurse prescribed, and I think this has been on our Facebook page, prescribed I don't know what you call them, lollipop sticks, I suppose, with a product on it called Fusion, which is actually a really, really strong adhesive as well as a really good barrier. And it's helped my skin a lot. But I only use it occasionally because I'm aware it's quite expensive. So I only use it, for example, if I'm going out and I really, really don't want to leak. And change in stoma size, and that affects the cut of your flange, how you get your hole cut. Well, it affects that. If your stoma gets smaller or bigger or what, for whatever reason, that needs to be. Otherwise, if your stoma gets bigger and the hole stays the same, you risk cutting into your stoma, which you don't want. I mean, it probably bleed, but it doesn't, stomas bleed very freely, so you don't need to worry about that too much, but always get it checked. The third one is what I always called operator error. In other words, basically, it's my fault. And it does actually tend to be the most common. Sometimes if we don't make our skin dry enough, if we clean and then the skin isn't dry enough, then a new pouch isn't going to stick. Because you've really got to make your skin dry. So do try and make sure that's the case. And if you put barrier cleanser, a barrier wipe on, or sometimes it's a spray, make sure that's dry too. Different products dry at different rates. So do make sure of that. And one thing is, I don't know if some people get away with it. I don't. I don't use shower gel or anything like that because I discovered that it's quite hard to get that off. And if you do shower with your bag off, which some people do, I can't because I've got two, and it would increase risk infection. But if you do shower with your bag off, just make sure that it's totally clean, the area, if you've used soap or gel or anything like that, because if it doesn't stick, you know what's going to happen. Just basically, just to recap, if you think about what I started with, which was saying that it's practical and emotional, if you have a look at the practical bits that you can do, for example, contact the stoma nurse, make sure you're doing everything upright, make sure, and go with a list. say I've done this, 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 and this to your stomach nurse, and that'll give them the information they need to maybe help you along and solve it. So solving the practical can actually help the confidence bit and enable you to move on. So anyway, I hope that's helpful. And I'm sorry I'm not there tonight. Anyway, okay.